Next up is Chantel Upshaw Houston, who will be sharing her expert perspective on the dynamic role pharmacists play in supporting public health. The Ask the Pharmacist booth is brought to you by the National Pharmaceutical Association. Let's give a warm welcome to Chantel Upshaw Houston.
All right, how are we doing today? You guys feeling good? All right, so I'm here with the National Pharmaceutical Association. So we are an organization dedicated to representing Black and other minority pharmacy professionals. So we have pharmacists, we have pharmacy students, pharmacy technicians, and other members as well that are in pharmacy. We are also committed to serving underserved communities. So what our work does is we want to make sure that we educate the pharmacy profession and the pharmacists that are a part of our association on how to deliver culturally competent care and how to deliver care that is inclusive and respectful of all people. Okay, we all look different and we all have different, backgrounds. There are also systemic things that are working against us, right? So how do we ensure that your pharmacist is the person that you see the most, right? So how do we ensure that that person is also thinking about everything that makes you a whole person besides just the medications that are in front of you? So, like I said, pharmacists are one of the most accessible healthcare providers. You have to book an appointment, with your medical provider, and they might not be able to see you in 3 months or 2 months, but you can always go on down to your local pharmacy and talk to your pharmacist. So, we encourage everyone to talk to your pharmacist. We're here today at the booth. We have some Ask Your Pharmacist handouts that we have. So there's certain questions that are important to ask your doctor, your medical professional, your prescriber when you start a new medication. So we have some of these at our booth downstairs. We also have some trackers for you to track your blood pressure. So if you're on any blood pressure medications, I'm sure your doctor has talked to you about the importance of tracking your blood pressure at home. Do we do that? Maybe, but we can do better if we track it and then we bring our results to the doctor. So that way, when you go to the doctor, your blood pressure it could be high that day for a number of reasons, right? But if you bring that paper from home and you say, "No, doc, I've been good. Look, here's the evidence," then they can't argue with that, right? So we have to be careful with making sure that we have to take responsibility for our own care too. So part of that is knowing what's going on with you between your doctor's visits. Part of that is tracking information. Why was my blood sugar high? What did I eat? What did I do this day? And knowing that information between your visits will help you to be a better communicator when you do go to the doctor to talk to say, "Hey doc, here's what's going on." Then you have a better picture. So we just try to empower our patients and empower our pharmacists to care for the whole patient, for the whole person. So we are on the front lines of public health as pharmacists. So a lot of people might not be familiar with pharmacists and what all that we do. We do not just, pour pills in bottles. That is an important part of pharmacy. However, another important part is when you call the pharmacy and you have questions. What is this vaccine? What is this about? Can I get delivery? How much of my medications? How can I get that copay down? Right? So as pharmacists, we want to make your medications accessible. We don't just want to give them to you because the doctor says. We want to make sure, is this the right one? Does it interact with any of your other medications? You might have a cardiologist, an endocrinologist, and a primary care provider who are not speaking to each other, but where are all your medications right in front of me? So I can tell what you're taking and work with those providers to make sure that your care is more coordinated. Okay, so I am all about independent pharmacy. Personally, I'm biased in that way. So if you know a mom and pop store, mom and pop pharmacy that you can support, I always try to push people to those pharmacies. It's just a next level standard of care for those that need it, right? So if you are on a couple medications, you might not need a higher level of care. But if you get to the point where you're on 15 or 20, you might need a higher level of care. And we do have patients like that, right? So what do? We offer free delivery and we package medications, right? So you don't have to fill your pill box. You can get a month of your medications all packaged up for you. So if you're not familiar with some of your services that your pharmacy offers, I would encourage you to just look more into that because there are ways that we can help you manage your meds better. Ask questions about your meds, track your side effects. What are you experiencing? When you start a new medication, you might have some side effects. You might need to eat before you take a medicine, right? So before you stop, ask. Before you stop taking something, ask. Ask your pharmacist, tell what's going on. There's other alternatives and there's a way to reduce side So we just want to promote safe medication use, not just medication use in general. We want to make sure the medications that we're providing are important and safe, and they work for you and your unique makeup, okay? So the other important thing that we do is promote representation in pharmacy. So we need students, we need to go into elementary schools, middle schools, colleges. We need to bring more Black and brown pharmacists, Black and brown doctors into the healthcare system, because we know that better care comes from a provider that looks like you and understands you. So that's why we're here. Come and see us downstairs. Thank you.